Good afternoon. This hearing will come to order. Before we get started, would just like to acknowledge that this is the first time chairing a hearing that I'm not wearing a mask. And it feels great. I've been vaccinated. The people in this room have been vaccinated. These are among the freedoms that you get back if you've been vaccinated and waited the full period to achieve your immunity. So, to business. 9 months ago, this committee examined the Bureau of Indian Education's COVID-19 response and the administration of COVID-19 relief funds. This hearing will expand the conversation to include the voices of Native school administrators, including principals from non-BIE schools. For over a year, we have found ourselves navigating through unprecedented loss and change due to the coronavirus. In our schools, the pandemic has impacted learning and disrupted foundational support services for students across the country. Congress responded by providing supplemental funding in the CARES Act to support schools and education programs in their COVID-19 response, including more than $222 million for the BIE. And the fiscal year 2021 omnibus funding bill provided additional funding resources to help schools with their COVID needs. But for many Native leaders, educators, and school officials, critical federal resources have been difficult to access or even non-existent. That is not acceptable, especially during a pandemic. The United States must fulfill its trust obligation to support Native-serving schools and provide comprehensive educational opportunities to American Indians, Alaska Natives, and Native Hawaiians. And that's why this committee worked to ensure President Biden's American Rescue Plan contained more than $2.5 billion for Native students, including the first dedicated funding for Native Hawaiian and Alaska Native education organizations to address their COVID-related needs. Indeed, help is here. Our committee's work, however, must continue. During today's hearing, we will explore lessons learned from COVID-19's impact on Native students and schools, underscore mental health and support services needs for Native students and their communities, and examine Native schools' infrastructure priorities to improve school safety and enhance digital learning capabilities. Before I turn to my vice chair, I'd like to welcome Dr. Kamana and extend my thanks to our witnesses for joining us today. I look forward to hearing from each of you. Vice Chair Murkowski.